so pain and pressure in and around here, especially with thick nasal drainage, either going down the front or down the back. Some of the loss of smell, pain and pressure in the teeth, the maxillary teeth would be a good indication that there's these sinuses involved. So there's a lot of these signs and symptoms that people say, boy, that's just my life anymore. And it's we look at chronic being probably 8 to 12 weeks of symptoms in a row. Sometimes they get better off the antibiotics from some acute infection, but the rest of these symptoms is kind of pain, pressure, congestion, never seems to completely leave them. Those are the kind of things that would say, hey, this probably is chronic sinusitis. We look in with a camera. We always have a little bitty scope, we call it, looking in the nose, and then we have a little introducer that you use with the other hand. We look in there, have these little introducers that are made to find those natural openings with a gentle curve that kind of looks the right way. Get those in the right position, and then you have a little wire that's got a fiber optic cable run through it, a bright light on the end of it, and so we kind of get that to feed in. And so you say, well, we're in there, no trouble, and then you feed that catheter over the top of it, and then these balloons are very, very strong, just like the ones for angioplasty, and they blow up to 10 to 12 atmospheres of pressure. They don't keep getting bigger, they just get real tense. And the idea there really is to remodel the bone a little bit. There's all this eggshell thin bone forming the walls between all these sinuses. When you get in there and pop it open, it actually does make a little bit of a snap, crackle, pop, not a real loud sound, but that actually remodels that bone, so that's the reason these stay open. This is not done until people have already tried things like nasal steroids, nasal irrigations, allergy medicine if they have allergies, and antibiotics in most cases ahead of time already. And chronic sinusitis is a medical problem with an anatomic component, so we're trying to take care of the anatomic component. It's always important to have people's expectations be correct. Doesn't mean that afterwards you'll be off your nasal sprays, most likely. A lot of those things are kind of the maintenance thing, because maybe you do have allergies and we can't cut that out. If we figured out how to do that, we'd be doing a lot better probably. But there's some things we can't completely correct, but we can make your anatomy work for you instead of against you every time you get a flare-up of allergies or a cold. We are getting to the point here across the country and some offices in town, including ours, we're able to do a good portion of this in office, no general anesthesia. In fact, sometimes no sedation whatsoever, just local numbing medicine, and they're driving themselves there, driving themselves home, just like in the dentist's office, or something that used to be a week off of work and somewhat miserable. We're turning people around the same day. With the sinuplasty, there's times we're just feeling the pressure off immediately. It's a little hard to say because we have it very numb. So within the first couple of days afterwards, we still get people, yes, saying, hey, there's relief already.